been a long time. It's been a long haul. I enjoy the work I do because I work with developmentally handicapped people. I'm not only their caregiver, but I also help them. I take them to the doctors. I nurse them when they're sick. I help them with eating. I help them with getting dressed, bathing. When they need a hug, I give them a hug.
A lot of our clients, we are their family. Like I bring my clients camping with me for the first time. He's never been camping, you know. So like, do things like that. I mean, it's more rewarding than sometimes the pay.
There's times where we have clients who don't have a home to go to. They don't have family to go to. I've taken them into my home.
We are their voice. We speak for them because a lot of them don't speak, especially when they get sick. I mean, we take care of them now, but it comes a time when they get sick, they go to the hospital. We had clients that were dying on their deathbed, and we have a staff here that crawled into bed with that client while he passed away. Yes, we're paid, but not enough for what we do, and it's not always about the money.
I chose this line of work because the clients that we service are very special to us. We have something inside of us as developmental service workers that we care for others, and all we want to do is provide for our clients and give them a quality of life. And it daily becomes a struggle for us because we can hardly provide for our own families on the wages that we make, and there's constantly cutbacks.
I've been with this association since October 1984. When I started out, I was getting $3.10 an hour. I am now almost at my 30-year mark where I should be retired, and I'm only getting $20.82 an hour. So I don't see that I'm being fairly compensated. There's nothing there for pension. I'm almost at pension age. I have a little bit of sick time accumulated, so I'd have to go and use that up, and once that runs out, who knows? I don't know if I would have to go on welfare or something like that, because I don't have any other income.
I work part-time. I work, I'm scheduled 3 shifts every 2 weeks. That's all I'm scheduled for. But I'm always working every 2 weeks, 100+ hours.
At times we're forced to work double shifts. If somebody calls in sick, we can't leave, so our children are left at home with babysitters or whoever they may be with at that time while we're stuck at work.
I have 3 kids, so when I only had the 2 kids, it was just as hard because when I got home, I got my kids out to school. If I didn't come home, there was no one to send them to school. A few times it's happened that I've had to just call in sick because there's no way that I can possibly, my body just can't bring itself to going to work, you know. At midnight again, it just, physically it can't happen, but sometimes management tells you that you have to come in because they can't find someone to fill your shift for that night.
We have a lot of people that are on compensation because we have clients that will grab your hair, will pull you down, will break your arm. It's hard enough to work there, you know, but again, I enjoy my job.
Well, a lot has happened in the last couple of years. I was injured at work. I had surgery. I've been on a modified position since 2007. I continue to be in a modified position, modified hours, and WSIB tops up my pay. Unfortunately now I'm in a position where I may have to be retrained. I may have to change my career and be limited to what I'm able to do because I've literally broke my back for this association.
My health is not good. I've been hurt at work a couple of times. I have a bad back now from lifting because back in those days they didn't have all the equipment that they have now. So you had to lift. You had to lift to bath them. You had to lift them from the floor and from their chair to the floor and from the floor to their chairs. You had to lift them in the tub and out of the tub. So my back's ruined now.
I've got nocturnal epilepsy, means I have seizures in my sleep. The medication that I take costs me $208 a month. It's rather expensive, and you know, being employed part-time by this employer with no benefits at all, no medical coverage, nothing, that's $200 a month. That's a big chunk of my wage, like, you know, with my other living expenses for food and rent.
Through the cutbacks as well, the services for our clients are cut back. So the enjoyment that they used to get on a daily basis is being cut back for them as well.
I know that some of it is related to the government cutting back and stuff like that. But at the same time, there are times when we should have gotten raises that we didn't get.
Over the last couple of years, things have become very stressful. A lot of our demands have been unreasonable, and we've been forced to do things perhaps a lot of us are very uncomfortable with.
Great group of people, and really sticking to their guns and fighting for fairness and fighting for the people that they help and support in society. And really they do a great job. So we'll be coming back up in the next couple of weeks to do a rally with them and help them out.
It has me scared and worried, but at the same time, if I back down now, it's going to be tougher the next time around. And we're all in this together. And we all want to see a good future for everyone.